So friends, this is the second part of the video. In the first part, we had discussed hair loss or alopecia during chemotherapy, and I had introduced you to the concept of scalp cooling technology. Now this scalp cooling technology is available with us at Narayana Superspeciality Hospital, Gurugram, and we are fortunate and lucky enough to be the first one to bring this technology in Haryana as well as in Gurugram. So let us now understand in detail that how this technology helps for a patient who is undergoing chemotherapy. Now first of all, that every patient has a different response of hair loss to chemotherapy. Every female may have some hair loss, total hair loss, 90% hair loss. Similarly, when we use scalp cooling technology, there is a range where we can quote that it can prevent hair loss in 50 to 70% of the patients, and this depends upon the type of chemotherapy drug, the dosage of chemotherapy, duration and protocol of the drugs we are using. So someone may have the chances of not having hair loss can be 30%, 50%, and in the best of the situation 70%. Also, if some amount of hair loss happens while you are undergoing scalp cooling technology, the regrowth is fast and you have much better, stronger hair, and the volume of hair is more. When we have a hair loss, it takes 4 to 6 months for the hair to regrow back. Whereas if you are using a scalp cooling technology, even if you have lost some amount of hair, the hair will regrow 3 to 4 times faster, and within 1 or 2 months you will have sufficient hairs back. This is about the efficacy. And also one more very important point is that this while you are using scalp cooling technology, it does not interfere with the efficacy or with the control of chemotherapy on the tumor, and it will not at all interfere with your in controlling the cancer. Now there are mild side effects. These side effects happen in almost 15 to 20% of the patients, but they are very mild because you are using an ice turban for a couple of hours. You can have a headache, you can feel chills during the procedure, you can have mild dizziness, and these are all temporary. To avoid this, you can take extra blankets while undergoing this ice turban procedure, or take hot liquids, and that will reduce the side effects. Now, how to prepare yourself if you are planned for a cool cap or a scalp cooling procedure, you have to come as your routine daycare admission. Cool cap is applied to your head 30 minutes before you start chemotherapy, that is during the pre-medication phase. During the infusion of chemotherapy, the cap is applied snugly fit to your scalp, and then after finishing chemotherapy, we continue this procedure for 2 hours. You have a routine normal daycare admission. During this procedure, you can eat, you can drink, you can chat with your friends, and there is no isolation required whatsoever. And it is once the procedure is finished, after an observation period of 15 to 20 minutes, you can go home after your discharge. So the question which was asked to me for last 10 to 15 years, that doctor, can you do something to avoid hair loss during chemotherapy? The answer has been unfortunate no. But now with this new technology, yes, there is definitely a hope, and definitely a good hope, that we can do something to prevent hair loss, mainly for young working females, but also for the males who are desirous of preserving their hair during chemotherapy. So I wish that this technology is helpful to all the females and males who are desirous of preventing their hair during chemotherapy.